Madison. I'm going to be your nurse today.
Okay.
We're just going to do like a partial assessment. I'm going to go from your head to about your waist. Do you have any questions before we start? I'll explain to you the whole time what I'm doing, just so you know. Before we get started, I'm going to wash my hands and make sure we have provided privacy. And when I enter the room, I'm going to inspect him overall, make sure he's clean and his hygiene is good. And then I'm going to look at his skin and check the color and the temperature. And then his skin turgor, make sure he's well hydrated, check for any bruising or scarring. Then we're going to start with his head and look at the size of it, the symmetry, and check for lesions or bumps. His hair distribution is good. Check for temporal arteries. Okay, then I'm going to check your lymph nodes. This is your preauricular, your postauricular, and your occipital here, your tonsillar, submandibular, and your submental. And then this is your anterior cervical chain, your posterior cervical chain, and your supraclavicular. And you shouldn't feel those. You didn't have any tenderness with those.
No.
Okay, we're going to check your cranial nerve 5. You can clench your jaw. And close your eyes. See if you can feel this.
Right cheek. Forehead. Left cheek. Jaw. Nose.
Okay. And then cranial nerve 7. You can smile. Just looking at symmetry. Frown. Raise your eyebrows. Puff your cheeks. And purse your lips. Okay. And then we're going to look at your ears. We're going to feel, make sure there's no nodules or masses on them. Look at shape, they're symmetrical. And then we are going to look in your ear. And we're looking in there, and the membrane should be shiny and gray. And on the right side, the cone of light is at 5 o'clock. And on the left side, it'll be at 7 o'clock. Again, we're palpating for masses, so the auricle and then the tragus. Was there any tenderness with those? Okay. And then I'm going to turn you around, and we're going to do a few tests to check your hearing and conduction. Okay, and I'm going to whisper back here. If you can just tell me what I'm saying.
Okay. 1, 2, 3. A, B, C.
Okay. And then with the tuning fork, we're going to do a couple tests. And I'm going to put this on the top of your head, and you're supposed to be able to feel it on both sides. Okay, both sides?
Mm-hmm.
Okay. And this one, I'm going to do it and put it back here. And when you no longer feel it, I'm going to put it up here, and then tell me when you no longer hear it.
No. No.
I'm going to do it on this side.
No. No.
Okay. And then we'll look at your eyes, look at your lashes and your eyebrows, make sure your hair is evenly distributed. Your fissures are equal, they're the same. Look at the sclera, it's supposed to be white, and it is, and the conjunctiva is supposed to be pink, and it is, and you haven't had any discharge or weird stuff going on. Okay. Let's see. This is testing your sight. Hold this 18 inches from you and read it for me.
C-T-M-T-E-T.
Okay. And then right over here is the Snellen chart. If you could block one eye and read the lowest line that you can see.
D-Z-R-C-T.
Okay, and do the other eye, lowest line you can see.
D-Z-R-T-C.
Okay, I'm going to check your peripheral vision, so let me know when you see it.
No. No.
Okay, I'm going to check your pupils, make sure they're reactive to light. Okay, and then I'm gonna do the wagon wheel, so just follow this with your eyes. Okay. And then we would look in your eye with the light and check for the red reflex and any discoloration. Okay. And then your nose, have you had any problems with your nose, any surgeries?
No.
Do you have any trouble breathing? Okay. Hold one side of your nose and see if you can breathe like that. Okay. And then hold the other side. No problems
A little stuffy.
other than stuffing. And then you look in your nose, make sure there's no occlusions or any abnormalities. And then I'll check your sinuses. If you have any tenderness, let me know. The frontal sinus is up here.
It's fine.
And then you have your ethmoid and your sphenoid, and then your maxillary sinuses. No tenderness. Okay. Then we'll look in your mouth, and if you could open up, I'm gonna check inside here, and it looks moist and pink. And say ah, and lift your tongue up and check underneath. Okay. Okay. And then clench your jaw. We'll check for TMJ and open up. Okay. No popping or anything, so you're good. Okay, now we're gonna look at your neck, and we're just looking at the skin and checking, make sure there's no discoloration or anything. And your trachea is midline. And check your thyroid gland. I'm gonna go behind you though. I'm not choking you.
You sure?
Okay. Yes. When I tell you to swallow, if you'll swallow for me. If you swallow. I'll do it again. Okay. And then I'm gonna check your carotid artery. If you'll tilt this way just a little bit. Okay, tilt this way. Okay. And I'm gonna listen over those, make sure we don't have any breeze. And I'll listen with the bell for breeze. Okay. Do you have any trouble with range of motion, like when you move, you don't have any stiffness in your neck or in your shoulders?
No.
Okay, you shrug your shoulders? Okay. Okay, and if you'll just breathe normally, make sure we have symmetrical chest expansion, there's no abnormalities there. Can you go around this way?
Okay.
I'm gonna get you to say, lean up just a little bit and say 99 for me.
99,
Okay, say it again.
99,
And
90.
again.
99.
Okay. And then I'm going to percuss over your lungs back here.
Okay.
Okay. And I'm gonna listen to you back here. And just breathe normally. Okay, and while I'm back here listening, if you'll just say E for me.
E. 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 E.
Okay, and now if you'll just whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, I'm turning you back this way, and we already looked for chest expansion, and you just say 99 for me.
99.
Okay, and I'll listen to your lungs right here. was listening for bronchial sounds up here, bronchiovesicular right here, and then vesicular down at the bases. Okay, I'm gonna go ahead and listen to your heart, and we'll listen to all 5 points. Okay, so on your right side we have the aortic, and it's at the second intercostal space. Okay, and then on the left side is pulmonic at the second intercostal space. And then at the third is Erb's point. And at the fourth is your tricuspid. And then at the fifth intercostal space, the midline, is your mitral, and that's a point of maximum impulse. That's your apical pulse, and you listen for 1 minute. And then you would document the rate and the rhythm after you listened. Okay, and if you'll stand up, I'm going to get you to go ahead and lay down, and we'll finish it up. So, has anyone told you that you've had murmurs or extra heart sounds?
No.
No? Okay. If you'll lay on your left side, I'm going to listen and make sure that you don't have any of those.
This is comfy.
And so you listen at the same 5 points, the aortic and the pulmonic, Erb's point, tricuspid, and then you're going to listen to the mitral with the bell, and that's where you'd hear murmurs the most. Okay. Alright, you can lay back on your back. And I'd raise you up like 30 to 45 degrees and look, make sure you don't have any distension in your jugular veins, and you don't. So you can lay back down. Okay, and with your abdomen, I would inspect the skin, make sure there's no bruising, no noticeable masses, and that it's symmetrical. And before doing any percussing or palpating, you auscultate first, because you don't want to mess up any of the vowel sounds.
Okay.
You start with the right lower quadrant, and you can listen for up to 5 minutes. And you go to right upper, left upper, and left lower. And then you'd want to listen for bruits, so you'd want to listen to the abdominal aorta, and that's midline. And then the renal arteries. And your femoral arteries down here. Okay, and then you do percussion on all 4 quadrants. And you don't have any tenderness in here?
No.
Okay, and then you palpate and make sure the patient tells you if it's tender.
That's fine.
And you palpate the liver and the spleen, and if they should not be palpable, right? Okay.